Hello, everybody, and welcome back to the Star Freud Wellness Podcast. I am your host, Star Freudenberg, and for today's podcast, I want to talk to you about something we literally look at many times a day, probably without awareness, and not really knowing what they mean. And I'm talking about your fingernails. And I would say probably the vast majority of the population, being women, don't really know the condition or what their fingernails are telling us because they have them covered, whether it's with nail polish, gels, acrylic nails, etc., all the fancy things that we do for aesthetic purposes. And maybe I go a bit deeper, that society has conditioned us to believe that, in order to be beautiful, we have to have certain things, and nails being one of them. I don't personally have my nails done for various reasons, because within working in the medical field, we are advised to have them short and not colored. And this is most likely for health and safety reasons due to cross-contaminations. You don't want to get anything under your fingernails that could, one, infect you as the practitioner or the healthcare assistant, or vice versa. You don't want to transmit something through cross-contamination onto another patient, right? But just like in any story within our body is a very telling organism, and when it's not well or when it's deficient in something, it's going to express itself. So it's almost like, in terms of the subject, if your fingernails could talk, what are they saying? And it's just a couple of things that I noticed because I study all these different modalities and understanding, just through observing someone, what their health issues could be. So I find myself almost being portrayed as a psychic when I go, oh, but are you suffering with this and this and this and this? Just through the body's telling signs. And people go, oh, how do you know that? That's so scary. And it's just, if we pay attention to our bodies, then this is what we'll know and how to treat ourselves. So I do think it's a bit, maybe not good is the right way to say it, that women cover their nails. A lot of issues as well, I notice in clinic, is people with mold exposure or fungal infection usually translates to having fungal toenails, and most people don't do anything about it because, one, it doesn't actually physically hurt or create any pain. It's just sort of there and looks a bit ugly. And then not treating it has knock-on consequences because that can spread into your body or spread into more nails and have lingering consequences that you may not experience maybe in the first couple of years, but could have detrimental effects in the oncoming years. And mostly speaking, that has a knock-on effect to your gut health. And if you listen to most of my podcasts, your gut health is basically the control center of your body. If the gut is unwell, then the rest of your body will start expressing itself accordingly. So we want to make the gut health center as healthy as possible and manage as well and optimally as possible so we can prevent this. And especially the goal is preventative medicine. So if we look after ourselves today, then we can prevent any problems in the future rather than a problem arises and then we have to deal with it, right? So we want maintenance rather than dealing with it. So I would say, if you're mindful and you don't really care too much about the aesthetics, try not doing your nails, in terms of mostly women who do, because they're very damaging. Most women end up getting caught in this vicious cycle because their nails become so damaged from all the topical treatments that they do, that their nails look really ugly for a short period of time and are very brittle or very paper thin and fragile fundamentally, that they end up continuing this cycle. But it sort of needs a period about 3 to 6 months that you can sort of bite the bullet, and then you'll see your nails will come back to the quality and strength that they were, or you can use some support to help you improve your nails, which I think is really important. Another really mindful thing is how we're slowly poisoning ourselves. So any topical treatment within manicures, pedicures that you get done, you're putting chemicals onto your body. And I have noticed in the recent years that they're starting to make more vegan-friendly products and more natural-friendly products. But fundamentally, this is some form of chemical, aka some form of toxin. And most women, from observation, do their nails every 2 weeks or so. And then through that, you think about, let's call it 20 areas on your body you're treating with this micro exposure of toxicity. And then people wonder why they develop health issues. And this could just be one specific way. So nails to get done in the salons are quite expensive. And also when you go in the salons, if you smell that sort of smell of the nail varnish, is quite toxic as well. So if you're exposing yourself to that maybe once to twice a month, these micro exposures are what causing health issues, or maybe lung deficiencies, or whatever knock-on effect. And I always have wondered, and I'm going to just put this thought into your mind as well, is I wonder what the lifespan or how many years have been taken off by the individuals who provide the salon treatments or nail treatments, or beautician treatments. What do they call themselves? I think nail care artists, something like, anyway, it doesn't matter. I wonder how long their lifeline is, because they're constantly inhaling and breathing in this nail varnish. They're surrounded in it almost like a hot box and constantly exposed to it. So I wonder how many years they take off their life just by choice of career, and obviously some not by choice, but just because of what life has offered them on a plate. But it is quite fascinating to see, and I always have wondered if we could do a research project just tracking the mortality rate of these individuals, about what they're doing. And they don't have some are wearing masks, but I mean, it's not going to sustain you long enough. It might minimize the exposure. But anyway, side note as always. So sort of coming back to your fingernails, and I would say there's 6 different types of nails that can express themselves that could indicate a different health issue. So if your fingernails could talk, what are they potentially saying about your health? Right. So you'll get the 6 types being brittle nails, yellow nails, nail pits or depressions, vertical ridges, horizontal ridges, and dark streaks or marks. So I don't know if you've ever experienced any of them or not. You also can get white spots in your nails as well. And this is what I commonly get, which is a zinc deficiency. So I need to, almost like a goblin, I have to eat a lot of zinc. I don't know why. I need it more than most. I take 2 to 3 tablets a day and I still show up for zinc deficiency. So it just is sort of how my body makeup is. And is what I always say to people is a staple in the diet. But you will, if you maybe are, probably whilst you're listening to this, looking at your nails, just observe them. Do you have any of these white spots? If you put pressure on from your index finger onto your thumbnail, and you push down to see how strong that nail is. Is it quite sturdy? Is it rigid? Is it strong? Is it flimsy? Is it telling how brittle your nail is? If you, I don't know, for example, knock your hand by accident or do something, or maybe you're washing your dishes, and then you do something else, are your nails then very flimsy as well and brittle as well? If you're, for example, someone who's, for example, you don't have a lot of money, you want to get your nails done, and you prolong, I think, as I said, because I don't do my nails, you on average need to change your nails or get them retouched up every 2 weeks, but you're really trying to make one treatment last a month rather than 2 weeks, so you leave the nail on for an extended period of time, then there's a lack of oxygen to the nail, and then the nail can end up underneath becoming a bit yellowish from the length of toxicity of and being unable to breathe, and almost sort of like dying, but not quite. So you can develop yellow nails, but that could also be as a result of different health issues. You can develop pits in your nails or depressions, and that's usually linked to different type of health conditions as well, but could also be from maybe slamming your finger in the door, something like that. And there's obviously a key difference between health imbalance versus an accident, if you will. And then we'll talk about the vertical ridges, horizontal ridges, and the dark marks as well. So just as again, coming back to it, our bodies are always telling us something about our health, and whether we are present or not with it, this is where I'm trying to create these educational podcasts to help you understand. So what I want to do first is then say the typical 6 nails, and in summary what they could mean. So brittle nails, we're looking at poor nutrition, especially low vitamin A, C, or biotin, which is a vitamin B7, which is really, really, really good for hair, skin, and nails, and is an injection as well as vitamin C. It is an injection or a vitamin shot that I offer at the clinic. So if people come to me, especially with people having issues with hair falling out, the hair needs to regrow, or the strength and quality of the hair / nails, then I recommend doing a biotin shot for a certain period of time. And usually in terms of a health condition is related to hypothyroidism. So for me, when someone says to me that, or when they come into the clinic or we have an appointment or do an online nutritional consultation, we talk about brittle nails, and usually for me that's an indicator of saying that someone has low protein in their diet. And as I say to people, protein deficiency often leaves its mark on the skin, hair, and nails, which are largely made up of protein. So when I perform kinesiology, and protein is a question mark for this individual, this person, this being, this client consult, then I'll say, okay, well, let's test if there's an imbalance, and then I'll actually use your hair to be able to define whether this imbalance is there or not. And the common issues for people is usually related to the metabolism. So you'll get the thin people who seem to eat whatever and excessive amount of quantities that just, and I always say the carpet doesn't match the curtain. For what they're putting in, for what they're showing, just doesn't match. And for me, they have a lot of fire in their body, so their metabolism is really high and they're just burning at a rapid rate. Or you can get other people that have very slow metabolisms and they're not digesting sufficiently or properly, and therefore not burning enough, and they're not converting the nutrition of their food appropriately into the body, and therefore not going to the different parts or where they need to go, and in this case the extremities, which can indicate something within the body, which is, again, brittle nails can indicate low protein. And another common cause of brittle nails in terms of health conditions is thyroid issues, and particularly hypothyroidism. So when you have a sluggish thyroid, then in effect it will then slow down your metabolism, which then slows down the production of your perspiration, which means less sweat leads to less moisture on the skin and the nails in this example, and which can cause dryness leading to brittle nails. So that's quite an interesting one. So when we move on to yellow nails, the main themes are, we're looking, or I go, these are potential things of diabetes, again, hypothyroidism, psoriasis, and thick yellow nails will typically indicate nail fungus, which is what I commonly see. And if you do have this, whether it's on your fingernails or your toenails, then I can help you nutritionally treat this. And we can even do this as, again, online nutritional consultation through treating with the fungal infection protocol, right? And then likely to add on to gut health protocol as well, because these two are interrelated. So chronically yellow nails may be related to underlying blood sugar issues. So then I usually think if someone has diabetes, I'm going to look at their nails instantly to get sort of more of an indicator. And what happens is when you have excess sugar in the body, it can lead to a process called protein glycation, which can break down collagen and cause the nails to become yellow. So obviously in this example, if you are diabetic and you need support and are not following sort of the right diet type for your need or your health condition, but in summary, you need to look at reducing carbs and sugar. And often I see people, more so than not, when they have, it's usually toenail and fungal infection, when they come to clinic for gut health support, it's almost 9 to 10 times out of 10, they also suffer from a bacterial overgrowth called Candida. And this Candida survives and feeds off sugar. So usually hand in hand, when you have this plus fungal infection, we will treat these two imbalances at the same time. But the main protocol is always reducing sugar and carbs. We'll go on to the next one called nail pitting or depressions. And usually I see this with people who are suffering with psoriasis or alopecia. And so one of my very good close friends has quite an extreme case of psoriasis and severe autoimmune conditions. So it's been a very fascinating experience to see how his nails look like versus what traditional nails should look like. So it's been very, very good for me to see. And for those who don't understand what it means when I say nail pitting or depressions, the term pitting usually refers to either a shallow or deep depressions, holes or pits in your nails. So it's almost like marks. And sometimes it feels like, I always want to explain, it's like someone's taken a screwdriver and it's just chipped away differently on your nail. Sort of like when you see when people do that wall, it's not internal walls, but exterior sort of walls outside your houses. Not as common here in the UK, but they'll have that style where they'll do the wall and plaster it, and then they'll do all of these little screwdriver chippings. And this is how your nail looks with all these indentations. So it may even look like white spots or nicks on the nails. And it's obviously scattered all around the nail plate. But usually this is a result from any inflammatory skin disorder, and the two most common being psoriasis or alopecia areata. It's the same inflammation that causes hair loss in alopecia and rashes in atopic dermatitis, psoriasis, and lichen planus can occur in the nail as well. So usually the solution is normally people have ended up going to dermatologists, done a couple of things topically, and then they end up coming to healthcare practitioners such as myself because they didn't end up getting the result. Because sometimes they will be offered topical creams or maybe get their nail completely removed. And sometimes it's quite an extreme treatment. There's also some laser treatments as well that I have some clients attending, and they basically get their nail dyed with this blue dye, and then they'll go for about 8 weeks of laser treatments to really destroy the fungal infection. But of course, sort of how my philosophy works is if you get an external treatment and work with me where we're doing an internal as well, and you do a double whammy, and then you'll have great success and get long-term sustained results. So now the next one is vertical ridges, and vertical ridges is just almost like vertical scratches or sort of indents, and I almost feel like it's someone squeezing your nail from either side, and it's almost as if the nail bed is compressing and making these slight ridges. If you had to like run your finger over your nail, obviously the nail what can I say, the bed of your finger, so obviously the soft side, and you can feel these ridges quite easily. And when you have nail ridges, this is usually common with aging and iron deficiency or anemia. So this is something I actually suffer from. So I have the white spots, which is zinc deficiency, and anemia as well. So these are things where I always used to think, oh, what does this mean? And then obviously once I studied, I was like, oh, now I understand what this means. So this is another symptom, and it's very common that I find within vegans or vegetarian people or people who don't eat a lot of meat, and it can make their body results in this way. So it's quite a quick and easy sign. So then you go to yourself, okay, if you choose to stick to a vegan-based lifestyle, then you need to think about incorporating different things, such as an iron supplement, or maybe getting an iron drip, or incorporating different types of foods that are more iron supporting in nature. Or if you are a meat eater and you still suffer from this, then you can come to the clinic and we do it all online and do a nutritional consultation. But there are different things. So I have a combinational shot. So there's 2 vitamin injections you can do that can increase the red blood cells. So I call it the anemia shot. You can do an iron drip paired with vitamin C, increasing your nutritional intake, and maybe you need a lot more in terms of what you're deficient, and then can combine with an iron supplement. Now, if you're listening to this and you go, oh, I'll just buy an iron supplement, you need to be so mindful about which one you buy, because majority of them create constipation in your body. And then this leads to a knock-on effect of gut health issues, which a lot of people come to me for. And usually they go, oh, I've been taking this iron supplement. And it's like, okay, we need to find you the right one for your body that doesn't create constipation. And also, if the very popular brand that's very well marketed in the UK is called Floridix. Not necessarily the one I recommend because it's full of sugar. But like most iron supplements, you need to just be mindful that when you do go to the toilet, your stool can be a different color and sometimes can be black. And obviously when people are used to pooing brown and all of a sudden there's like a black log that comes out, they really panic. And this is normal because this is what iron supplements can do. So just being mindful. It's sort of the same analogy, because I'm sure pretty much everyone in their life has eaten beetroot, but then you go to the loo, you wipe, and you go, oh my gosh, I think I'm bleeding from my bum, and then your nervous system starts raising all of these red flags, and then you think like, am I dying? Am I bleeding? Is it bowel cancer? All of these red flags, and then actually no, you're like, oh thank goodness, it was just beetroot. So it's just being mindful, the same for iron. So just to sort of talk more technically. So ridges that appear vertically along the length of the nail, so right from the tip to the cuticle, are technically called longitudinal striations or bands. So these vertical ridges are very common as we get older. And as we age, our cell turnover, so being the process in which our new skin cells are produced and take the place of dead cells, slows down. So eventually this can affect the smoothness of our nail. And however, if those vertical ridges appear alongside symptoms, such as anxiety, swelling feet, or excessive urination, this may also be associated with iron deficiency anemia. So, of course, again, the solution is if you suspect iron deficiency, or this may be an issue for you, you can come to the clinic. If you're worried and not sure, we can do a blood test, or I can use kinesiology to assess you as well. But increasing your iron naturally can also come from grain-free or organic or farm-bought eggs. So this can also help support you. But again, I work on a very customized approach rather than generic. So we can test specific iron supplements on you, or we can do a drip. But first, of course, we want to just see through a blood test. But again, this is just quite a natural way for you to go, maybe I need iron. Another point, because I'm thinking about my nails specifically with the zinc deficiency. So I get these white dots, and they just literally appear under the skin, so there's no markings, dents, or ridges. But depending where they are within the nails, so usually I say halfway through your nail, we'll be looking at a 3-month period. So if you look, and when I am looking at my hand right now, I'll have I've got 4 nails that have dots on various places throughout the nail. And some are quite at the top, some are midway, and some are more towards the bottom. So I always say about midway, you're looking at a 3-month mark. So if it's more towards the bottom, you can go, okay, so this is where I was representing a zinc deficiency about 6 months ago. I've got it midway about 3 months, and maybe something about 1 month ago as well. So yes, I eat zinc like Smarties. So yeah, if you have that, and also just interested to know where your markings are as well, that sort of, it gives you a timeline. The next one we are going to go on from vertical ridges is now to horizontal ridges. So horizontal ridges, you sort of think of flags of zinc deficiency, diabetes, and kidney conditions. Ridges that run from one side of your nail to the other are also known as bow lines. So bow is B-E-A-U, or bow lines, which in French means handsome lines, but probably not as handsome as you'd want to have them. And these horizontal ridges are associated with illnesses and conditions that suddenly slow or stop nail growth. And this is actually another important point about, are you aware about how fast or slow your nails grow? Because sometimes I think, gosh, my nails are taking forever to grow. And then mainly now, because of certain nutrition I'm on, I feel like I'm cutting my nails every few days, but because for my work purposes, I have to keep them really short. So it feels like, gosh, I just cut them a couple of days ago and here they're growing. So also just being mindful, aside from the aesthetic appearance of your nails, also about how long does it take to grow, because that can also be an indicator for, let's call it nutritional deficiency or not. So where was I? So conditions that can either slow or stop your nail growth. So common examples as a result of this arising could be or includes chemotherapy, diabetes, and kidney conditions. So for me, the solution would be to contact a healthcare practitioner, or such as myself, we do an online consultation, holistic health screening as well, and then we can see and take it from there, because it might be a series of things, might be something building up to something, or it just could be something quite straightforward and simple to treat. And the last one is dark streaks or marks. Excuse me, dark streaks or marks. So this can be as a result of a number of things. So either broken blood vessels, psoriasis, endocarditis, which is like a heart infection, or melanoma, if the black streaks are quite clean. So quite straightforward and clean. So this is another symptom that I saw with my best friend who has psoriasis, is that it's just a combination of things, but there's a lot of these black streaks in the nails as well. So aesthetically doesn't appear to be very beautiful. But what I can say, it's not very painful. So when I say dark streaks, it could either be black, brown, or reddish streaks that are beneath your nail. And it may seem like quite the cause of concern, and especially if you've never had it before and generating it. But people who have, for example, conditions such as psoriasis, autoimmune condition such as psoriasis, it's sort of this progressive issue that happens, and because it's happening slowly and consistently over time, they just sort of get used to it. Whereas if you're someone who's had, let's call it perfect nails, and then all of a sudden it completely contrasts to this, then of course you need to look at it. So again, like I said in the beginning of the podcast, so this is typical of health conditions, but then you can get the other side, which it could just be a typical result of a trauma accident to the nail, like I said, such as closing your finger in the door. So I had this before, where I was in my friend's car, and I was sitting at the back and I had my hand out. It was a BMW with a two-door BMW convertible, and I had my hand out and the car door was open because she was smoking, but she didn't realize my hand was there, and then she slammed the car door on my finger and it completely ate my thumb, or the tip of my thumb. It didn't fall off, so that was really good, but I've got this big scar. But what it did do is completely mess up my nail, and I think it took close to like a year to 2 years to really heal. And it was quite fascinating, because as the one, let's call it the initial nail, was falling off, there was another nail that was growing, and it was sort of working in tandem. Like as the second or the new nail was growing, it would start to alleviate or shed off the bigger nail. So it was sort of like doing it in a cocoon fashion, or a protective fashion, or like a sandwich fashion. So that was quite fascinating. But just to witness how there was which I thought for life it was going to be, was this permanent indentation on my finger. The coloration was black and blue. But to this day now, I don't have an indentation anymore. You would never know, basically, except if I had to press on my skin to reveal the scar. So that's quite fascinating. So I've obviously had extreme cases of where I've had my finger closed in a car door, in a normal door. And the most other common examples I hear is when someone's hammering something and then they hammer their nail by mistake, or anything of the sort. So there's a difference between that. And obviously, when there's a trauma cause, there can be blood as well. stuck under the nail. This actually reminds me of another time I had a car accident. I was a victim of a car accident, so it was a very, 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 very unfortunate event. But 4 cars crashed into me in a moment of 2 minutes. I came out alive. Don't know how, so I definitely feel very well protected. But what had happened is my big toenail, through someone, when they crashed into me from behind, my big toenail, obviously with the huge impact, hit onto the pedal, and I lost my big toenail. And again, one of those cases, I had a big trauma to the nail. There was a huge blood spotting under the nail, so it was completely black, and I had to wait what appeared for me, I think it was 3 years or something like that. So another also point to note is toenails do grow a lot slower than fingernails, and you got to think about that. They are a very far extremity. It's the furthest away from the heart, pumping circulation. We are mostly sitting all day in a sedimentary lifestyle, and there's not a lot of movement. So toenails do grow a lot slower than fingernails, and thus the healing process as well takes a lot longer. So just being aware of that, just in case you're like, oh, my toenails grow really, really slow, but my nails are fine. My fingernails are fine. So there's obviously that as well. So I've had, 2 extreme examples of witnessing how long it takes. And also when you cause a trauma to the nail, the whites of your nail, usually at the tips of the nail, will start to grow a lot further into the nail bed, sort of recovering. But if you just consistently look after the nail, I can personally vouch that it does grow back and behave as normal. Right. So, sorry, always side notes, but maybe it makes a good story. So in this case, coming back to dark streaks in nails, the discoloration you see can occur when blood vessels under the nail bed break, or can pop, or, they break and then can spread bleeding under the nail. And usually the color will turn blue, purpley, that kind of thing, and eventually black. Some people have said, midwives' tales, that you should take a pin and then you sort of just slowly rotate it into the nail bed and then express out the blood, or you just leave it. Or what I would say is just go straight to a professional. Again, if it's hand or feet, you can go to a foot specialist, or you can go to the GP or a dermatologist to see sort of how they would protocol and look after that procedure. So dark streaks can be caused by, now if we're going back to the health conditions, can be as a result of psoriasis or endocarditis, which I said is an infection in the heart. Black streaks may also be a result of melanoma, which is the most serious type of skin cancer, so always being aware. So again, consulting a dermatologist, where they can obviously inspect and know, because this is their area of expertise. Or of course, here in the UK, you could go to the NHS and first get a GP, and maybe they will refer you on to the dermatologist, or you're doing the dermatologist privately. So that's really your choice. Because since your skin nail health can say a lot about your overall health, I would say fundamentally it's almost important, if not a prerequisite, that you should consult someone, whether it's a healthcare practitioner, a holistic healthcare practitioner, a holistic doctor, a naturopath, a GP, whichever you are drawn to, or a dermatologist directly. If now, after me talking about this podcast, you notice anything odd about the look, the feel, or of your nails, right? I was going to say even smell, because sometimes you can smell your nails don't smell right, but it's not the predominant thing. It's more about the look and the feel. So if it's something quite serious, and in this case, maybe there's autoimmune conditions or heart conditions, or thyroid issues or endocrine issues in your family, maybe it might be worth checking your nails. Maybe now checking everyone else in your family and how their nails look as well. Because then we need to look at sort of adjusting things in your diet, which is of paramount importance, in a couple of examples talking about, changing protein, or maybe increasing the quality of your protein, changing your diet, doing some blood tests, adding omegas, reducing sugars, adding low glycemic index foods or carbs into your diet, or swapping them out rather than high glycemic, which create a sugar spike. Or blood sugar levels will spike and mess up which has knock-on effect to energy levels. So, it's quite a serious thing, but almost what I like to say, it's quite a genius thing about the technology of our human organism, about how we have these subtle signs that are alerting us, but we don't really have this general education. So when I run for president, I definitely want to incorporate classes that are going to be much more beneficial, like meditation, understanding the body, signs and symptoms to look out for. I always see people joke about teaching you how to do tax and all about taxes, and how to, entrepreneurship skills and basic fundamental life skills and life orientation and things like that. I think is really important. But yes, to now come to wind down on this podcast, have a look at your nails. It'll be good to let me know if you have some quite interesting nails. Maybe it's worth taking a picture. But look into contacting a healthcare practitioner, or respectively a dermatologist if you have some serious concerns, or even your doctor or /GP consultant, and take it from there. Yeah. So on that note, over and out wherever you are in the world. I am your host, Star Freudenberg, and this was a educational podcast about your fingernails and what they tell you about. So thank you very much for listening. If you enjoyed this podcast, please, if you can leave a 5-star review, just to help really build this podcast and give people an opportunity to find it as well, because obviously there's such a huge spike in wellness and healthcare podcasts at the moment, so it's hard to navigate through most of them. And then, yes, if you find anyone that you think you need to be concerned about, please share this with them so they can just sort of think about it and then make their own choices about whether or not they want to be seen to or assisted with, or maybe will buy some things or get some tests done. And just like that. So over and out. Thank you for listening wherever you are in the world, and please stay tuned for next week's episode. I am your host, Star Freudenberg, consciously empowering your mind and body through wellness.